Missing 5 toes, well, better than missing 1 foot or even a whole leg. Too many people are getting life-changing amputations when better options exist. Good morning. It is Thursday, March 23rd. I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we meet 2 patients who were able to avoid amputations thanks to a doctor dedicated to saving limbs. It's an especially important topic if you or someone you know has diabetes. Today, we are focused on amputations caused by blood flow problems, which go hand in hand, of course, with diabetes. Get this, every 3 minutes, someone loses a limb to diabetes, per the American Diabetes Association. And that's just in America alone. And most amputations wouldn't have to happen if patients got the right care at the right time. Alexis Del Cid shows us something as small as a blister can develop into something much, much worse. And just a slight warning, this next story does include a couple of images of open wounds.
I'm a pretty much joker.
Richard Pywell is the kind of guy who can keep a sense of humor about pretty much anything, even this.
I don't have toes to push down with, so I got to be careful when I'm climbing a ladder that I don't try to step on the ball of my foot.
While being shuttled around to follow up doctor's appointments by his devoted wife Carol is not exactly his idea of a good time, or hers for that matter, after 60 years, they know how to take care of each other. They're a good team, and this is just part of the package.
We bicker, but we love each other. We have fun. He tries to get me riled up.
How's it going, guys?
They also know how much worse it could have been for Richard.
Well, from where we started, I don't know if you remember, they were planning on cutting your whole leg off right there just below the knee.
It all started when Richard, a longtime diabetic, got a blister on his foot while clearing some brush. The blister got infected and continued to get worse to the point where doctors told him they needed to amputate his leg below the knee.
Limb salvage is one of my areas of interest. I'm pretty passionate about it.
That's when Dr. Adam Alley, a vascular and interventional radiologist, was brought into the case to work his magic.
The way we like to say it is saving limbs is saving lives. Diabetic population, people with diabetes, you can get what we call small vessel arterial disease. You can get blockages in your blood vessels just like in your heart, so you can get a heart attack.
It was a procedure that Dr. Alley knew about, but had never performed before.
So they called me to see if he'd be a candidate. He was the first one that I had performed.
What do you think?
It's rather incredible.
It would turn out his first one was a home run.
It worked out better than our wildest dreams, so that's great.
It has. Like I said, I'm very fortunate, I guess. The good Lord has not decided to take me yet, so.
Or his leg.
Thanks.
And both Dr. Adam Alley and Richard Pywell are joining us now this morning. And we're also happy to have with us patient Larry Byram. Larry dealt with an issue very similar to Richard's and was also treated by Dr. Alley here. How are you doing today?
Good, how are you?
Good to see you. Richard, I want to start with you because this all started with a blister, and we all get blisters. When did you realize that your blister had turned into something more serious and that you definitely needed to get to a doctor?
Well, that started, when we started clearing this property to build our new home. And like I said, we was clearing a lot of brush, and I stepped on a hot coal. I had a pair of tennis shoes on and got a blister on the side on my Charcot foot. And Dr. Horton's the one that actually repaired my foot, and basically from then it didn't heal properly.
So when did doctors bring up the idea of amputation?
That was several months after we lost my little toe, and it just like wasn't getting enough blood flow to heal properly.
So you had lost a toe at that point, is that correct?
Yes, after Dr. Horton had repaired the Charcot foot.
So what was that like, getting around as far as balance and pain and just walking and living everyday life?
Well, I basically just wore a boot, a hard boot pretty much after the procedure. And like I said, pretty much normal. I just kind of limped around. Did my hobbies, little things.
Right. Yeah, but nobody likes to be limping around. It sounds like you're pretty active. Dr. Ali, so help us connect the dots here. How does diabetes relate to vascular problems? We hear this a lot.
Yeah, that's a great question. So in the diabetic population, we can get what we call small vessel ischemic disease. So when you have diabetes, you have extra molecules running around in your bloodstream, and what that can do is damage the lining of the blood vessels, which can lead to scar tissue and buildup of that scar tissue over time. And the way that that works is as that scar tissue fills the vessel, it can cause a blockage. So you can think of it, if you have a garden hose and there's water running through it, and as it collects dirt or rock and sediment, the water won't flow through as well. The same is true of your blood vessels. So as that stuff builds up, you'll get blockages. In the diabetic population in particular, the smaller the vessels are the ones that it tends to affect. So the most important ones are in your heart and in your head, so you can get heart attacks and strokes. Additionally, for your legs, below the knee, the blood vessels start to get very small. And once they get small, you can get blockages in your legs as well, which leads to cases like the ones that we have here today.
Yeah, and interesting that you make the connection with the heart. The brain get blockages and can die off just like other parts of our body. Vascular problems, and that's how they lead to amputation, right?
That's exactly right, yeah.
So the American Diabetes Association says most amputations are preventable, but why are they happening?
Right, so the number one thing is important diabetic control. So following with your primary care physician if you have diabetes, or your endocrinologist for diabetic control is invaluable to helping maintain your health and maintaining a long life and decreasing your risk for amputation and kidney disease and other things like that.
And you're able to perform some procedures here at the health system to help prevent amputation. That is your passion. Tell us what those are. And we're seeing some video here of
yes,
this procedure.
Absolutely. So once you do have blockages, what you're looking at is we've crossed a very large blockage. That black dot that is moving up and down is a special device that actually has a diamond on it, and it spins at 50 to 60,000 RPMs. It actually sands the plaque to help open up the vessel. And so the black image that you see flashing, that's the dye going through the vessel showing that it's now open. So it's a pretty unique device that we've developed, not here, but we use it frequently. And it really works very well, and it's one of several tools that we have available to us to help open up, particularly these small vessels can be very challenging. And so that's a lot of what I do is once they get into those small vessels, you know, it can take some time. It can take several hours to open that stuff up from time to time. But with the right tools and the right team, you can get it done and hopefully help your patients out.
Well, I guess I can't imagine, Larry and Richard, how thrilled they were to get into your hands after hearing that, you know, they may have to have limbs amputated. So really interesting to hear these options. Larry, I want to bring you in again, another one of Dr. Ali's patients. You needed to have 3 of your toes partially amputated, and this also started with a blister. This was back in 2018. So what led to those amputations?
It was all because of a known thing called IgA vasculitis. At least that's what I believe it was Dr. Springer that actually told me. He's also there at KU Med. And, well, basically just as treatment of that and everything, that came down to where I still had a blister on that large toe, and that large toe just had a pool that would not go away. And eventually had me moved over to sitting there looking at Dr. Orr for wound therapy, and then he moved me on to Dr. Orr actually moved me on to Dr. Ali.
And then before you got to Dr. Ali, tell us about what it was like when you learned that you might end up losing a leg.
Well, the wound was and everything that it just started off basically as I'd walked. I mean, the secondary wound that actually appeared that got Dr. Orr's attention and moved me over to Dr. Ali was basically 3 basically cuts that I got from walking by a metal chair, which actually just sprung up and turned into a scab, and then just started growing from there and grew into a very ugly wound. But yeah, it's at that time and everything, Dr. Orr, before the referral and everything, was just like, you might have a possible amputation there going on below the knee. We'll try not to have that happen, but we got some good doctors here and gave a good word for Dr. Alley, and Dr. Alley gave me some very promising information.
So, Dr. Alley, the two incidences that led to the blisters for Richard and Larry is something that could happen to any of us, but how do we know that was diabetic related? Or do we?
So, well, with Mr. Byram's case, it's actually, he had a combination of arterial and venous disease. So there are different types of wounds you can get in your leg. And so some of them can be from your arteries and some of them can be from your veins. So it's important to have a comprehensive approach to figure out which one it is. They have unique appearances and features. And so with Mr. Byram, he had several wounds that we followed. He followed with Dr. Orr in wound care. He kept his appointments, and we were able to treat both his arteries and his veins. And once we were able to do both of those things, over time, his wounds both on his left leg and his right leg were able to heal. In addition to that, when you open up your blood flow, as Mr. Pywell was pointing out, your amputations will heal better. So even if you are getting toe amputations, it's important to have blood flow so that your amputation site will continue to heal. And so with Mr. Byram, we were fortunate that we were able to diagnose both of those situations. He did have arterial work and venous work done, all part of the cardiovascular system, and he had a wonderful result. We're really very pleased with the way that turned out.
All right, Larry, we're going to take a look at this foot and this leg. And just, everyone, this is a little bit of a show and tell, a little graphic, so just beware if you want to turn away for just a moment. But it really gives us an idea of what you were looking at, Dr. Alley, when you saw Larry and his toe blister first. So let's take a look, if you can, here at the monitor and tell us the flow of how everything.
Yeah, so when you get so as I was just speaking about, there are different types of wounds. When you tend to get them in your toes and it looks like a punched out lesion, they tend to be arterial. There's lack of blood flow from the artery, which causes that. This next one on the shin was probably a combination. So if you get one on the shin that's shallow and it's got irregular borders and it tends to be red around it, they can tend to be venous.
And that was on the other leg, so.
Yeah, so correct. So he ended up, so Mr. Byram had wounds on both of his shins. This one, because it's round, and we know from his arterial studies that he had arterial insufficiency, the primary importance for us was to restore blood flow to his artery for his, initially, before we treated the veins.
But then it got bigger.
So let's see. So yeah, so then this is the other leg again. So this is a different wound. So this one's shallow, irregular. It's on the shin. It had a large arterial and venous component. So we treated both of his artery to restore flow and his veins, his venous insufficiency below his leg here with a special medical glue. And once we were able to restore flow to the artery and treat his veins, we can see the result, and it was a pretty dramatic result.
And I think we have the before and afters.
Yeah, there it is. So yeah, so once we were able to treat his veins, treat his artery, and he had his appropriate surgical treatment, it really was a great result. And the biggest thing I'd like to emphasize is that when you have wounds like this, it's important that if you ever run a fever or you feel like they're getting infected that can spread to your body, to please seek medical attention immediately, because those need to be treated ASAP.
And what you're saying is that had you not have seen him, that they may have had to take his leg off.
Oh yeah, definitely. So without treatment of the underlying causes, the issues causing those ulcers or the reason that they show up, if without appropriate treatment, they'll recur. They just won't get better.
So we looked at the outside. Let's take a look inside. Show us what you're doing to make Larry better.
So these are the arteries. And so a good example is this picture on that side.
Okay.
The black is dye, so as it runs through the vessel, you can see it, which is open.
Okay.
Where it's white, there's a blockage because the dye can't get through. In his particular case, we used some advanced techniques where we got into a small vessel into the foot, and we came from above, from his hip, And this is the before picture, and then there's the after picture there. You can see there's restoration of flow to that blood vessel, so hopefully you can get blood to the area of the wound and help it heal.
And this case turned out exactly the way you wanted it? About as good as it can get?
It was,
for Larry.
yes, it was a pretty good result, so we were very satisfied with it.
So, Larry, we know that you could see the results, but did you feel different once you restored that blood flow?
Oh yeah, it was night and day. The pain that the wound was actually causing was actually quite extravagant. It was on some days unbearable. As the wound started healing and everything, the pain just started going away, and it's like that was the best thing I had.
And so how have things changed for you? Have you adapted to losing the toes? And are you staying active, as I know you want to?
Well, unlike Richard, he had all of his toes taken off, and I just had the 3 partials. The 3 partials were basically, the large toe, of course, and the tips of the remaining 2 interior toes. But it's gotten better. I'm still actually relearning how to walk properly, as I would call it, from years ago, prior to the wound appearing there. So, yeah, I've gotten much better. Quality of life is much better.
And that's what we like to hear. Dr. Ali, how serious is an amputation to a person's overall health? A minor amputation, I don't like to use that word, but as opposed to having an entire leg taken off a toe. But talk us through losing a limb, like a leg, and then losing even the smaller pieces, like a toe.
It's a great question. So we do categorize limb amputations as minor and major. So a major amputation is defined as an amputation above the ankle. So we know in the diabetic population that once you start getting major amputations or amputations above the ankle, your mortality rate actually goes down. So that's why we say saving limbs is saving lives. So if you can prevent major amputations, what we know is that it should help with your life expectancy and help you live longer. So.
And what about for folks like Larry who have to relearn to walk? I mean, we know his quality of life is so much better because of the pain, but what do you hear from patients as far as just trying to regain those new skills?
Oh yeah, they're usually very happy that they didn't have their leg amputated. It does take a little time and a little work. They usually get back to hopefully their regular daily activities and they're enjoying life. But yeah, it's certainly a result that we should hope for.
So I have to ask you, Richard, I want to bring you back in here. What was it like when you first met Dr. Ali?
Well, like I said, I was in the hospital. I was with my toes being chopped off or cut off, and like I said, it was just something that we wanted to try to save my leg. So, like I said, I was still very active, and like I said, I still do a lot of climbing on ladders and scaffolding and restoring vehicles and cars and motors. I'm just, I'm active in my shop about every day, so life's good. And like I said,
Shorter time.
So I take a lot of naps, so that I shouldn't do.
Hey, who doesn't? Hey, get them in while you can. I appreciate that. So, but I like that you were able to communicate. He was able to communicate with you what he needs to get back to doing, and then you get to see this result. Same question to you, Larry. What was it like that first meeting with Dr. Ali?
I was kind of skeptical at the point because it was kind of traumatic to hear the news of wanting to take my leg off, or at least below the knee, and I was like, that was just unheard of because was in the military for a couple of 10, 12 years. I used to walking a lot, and I'd always walked almost everywhere in my life. So it's like just being able to keep that in my life and everything was a great godsend. So I'm very happy for Dr. Ali's introduction.
Good. We're so glad you found him. Make sure you get your questions sent in to all of our guests if you have questions for them. You can go to YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. Let's get a quick check on our COVID count. Dr. Dana Hawkinson is in, Medical Director of Infection Prevention and Control. Good morning. How are you?
Hi, doing really well.
Hey, good.
Yeah. Right now, cases are still low, so 37 total, 24 active, 5 in the ICU, 1 less than yesterday, but still 1 on the ventilator. So.
Okay. got to get your
Yes.
thoughts on this one. So a new
Yes.
study is proving that social media influencers are not great sources of medical advice, right?
That's true.
Never heard of that before,
Yeah.
especially when it comes to prescription drugs. So in the Journal of Medical Internet Research, researchers interviewed 26 so-called patient influencers. Of course, they're paid by pharmaceutical companies to share their stories online. And Hawk, a little bit of a gray area here because on one hand, we like it when people are open and free and share their medical journeys. But on the other hand, when you're getting paid to do it, it raises ethical questions about the transparency involved. What are your thoughts?
Yeah, I mean, I think that's absolutely true. And we know that, here at the health system or University of Kansas Medical Center, whenever we're giving talks, we are disclosing if we've received any funds or any money or on any speaking boards or consultant firms for any, or consultants for any pharmacologic or research firms. I don't think this always happens with social media. And I don't know that, today's younger generations growing up just seeing a TikTok is going to understand that. I think that's okay if you give a testimonial, if you are paid, but you really need to disclose that. And second of all, that first point just about general people or social media influencers giving medical advice and things of that nature, I think that's very dangerous. And we've tried to hit out against that misinformation overall since the pandemic began, and it's probably just going to continue to increase. But for this story, essentially, it is concerning. And I think if you are giving testimonial and if you are paid by pharmaceutical companies or research companies, I think that's fine. It's just you have to disclose that to the people or on your site or on your TikTok, post or whatever that might be. As long as there is disclosure about that and there is transparency, that is what is important.
Well, and as we sit here on Facebook today, you're kind of the only influencer that we trust around here on social media.
Well,
and you don't get paid to come down here every day, by the way. I will, full disclosure there.
No, I think Dr. Stites is as well, certainly. But I think that is vitally important. And, certainly when I give talks around the state or in the region or for anything else, even in-house talks, we are obligated to disclose have financial disclosures just so that everybody knows that everything is transparent. And that's okay if you just have to disclose that. And that doesn't always happen here for sure.
But good to know. I don't think people scrolling through always know that piece of information. So good tip there.
Yeah, absolutely.
Any reporters with us today? Let's get to our viewer questions. And this is from Tina. And she wants to know, Richard or Larry, do you ever feel phantom pain or itching?
Well, I kind of feel like my toes are cold, but they're not because they're not there.
That's so interesting. Larry?
Yeah, I feel it when I'm walking sometimes. It just has a random feeling sometimes. It's like, why shouldn't be feeling that? There's no toes there. Or that part of the toe's not there.
Dr. Alley, that's so interesting. Explain it to us. What is the phantom pain all about?
Yeah, so you can, so when you've had an amputation, you can get something called phantom limb pain, and so it's essentially a neuropathy. So your nerve, where it's going, can trick your brain into thinking that what has been amputated is hurting. So it's something we're familiar with. And it's part of the process.
This is an interesting phenomenon. So Toby wants to know also, Richard and Larry, have you changed anything in your lifestyle since your amputation? Just the way you live, the way you move or eat or anything?
Not really. Like I said, I've really a pretty active life. I said when you get to be 83 years old, you move a lot slower than you used to. But like I said, I still, enjoy working in my shop, welding and building things. And like I said, we're restoring some old buildings on our property. So like I said, I'm still very active and enjoy life.
Larry, what about you?
Well, I actually have a hobby job that I actually do and everything. I'm actually a motorcycle instructor, so I'm on my feet. Last year, basically, because the wound is still fresh in my, repertoire here, that basically didn't finish healing until almost September, I think it was last month. was the end of the season. So I look forward to this season being able to sit there and actually go out and do some riding and actually be able to teach people how to ride motorcycles again.
Fantastic. Camilla wants to know, if I don't have diabetes, am I still at risk?
So you are still at risk for peripheral arterial disease. So
Okay.
getting blockages in your blood vessels, diabetes is one reason you can have it. There are other reasons to get blockages in your blood vessels, such as high cholesterol, high blood pressure, things like that, smoking. So it is what we always recommend is that you keep your regular doctor appointments. Your overall health and your general health is paramount. You keep your checks with your blood work and things of that nature. And that way, the earlier we can get to it, the better off it'll be. Should you have those risk factors, and managing them that way is really what we emphasize as a primary importance for all of our patients.
Okay, a couple of combo questions from Ruth Ellen and Vera, but how does one make an appointment with your clinic? And let me get back up here to Ruth. She just wants to know how our patients got in touch with you. So how does all that work as far as being referred?
Well, these two particular patients came from other physicians. If you would like to make an appointment in our vascular clinic with me, there is the Center for Advanced Vascular Care at KU. It should be available directly on the website. You just go there, there should be a phone number. Just call it and we can set you up.
All right, and last questions from Jeremy. What is, you said you're most passionate about this. What's the most exciting part of your job?
Well, the most exciting part of my job is seeing how much when our patients come back, and as Mr. Byron was saying, when their pain is resolved and they feel better, that is the most exciting part. It's not the actual procedure, it's the follow-up. So when you see them, they're doing better, they've kept their follow-ups and their appointments, and they're smiling again is definitely the best part.
Good to see these guys out with their motorcycles and back out in their
Yeah.
shop and welding and doing all those
You
good
bet.
things. All right, let's wrap this program up today. Let's get today's takeaway. Dr. Ali, I'll start with you.
So what I would like to emphasize for everyone is what we were just talking about. So when you do have those conditions, you're not going to feel the pain until it's too late. So diabetes, high blood pressure, they'll cause blockages and you won't feel anything, and it's not until the blockage is complete that you start having the pain. So I really do emphasize preventative medicine, so keeping your regular appointments with your doctor and general health care, and getting the appropriate screening exams, vaccines, everything of that nature is what I'd really like to drive home to everyone.
All right, Larry, your takeaway today. What do you want folks to know?
I would say exactly the same thing that Dr. Ali said, except from a patient point of view. His compassion and drive to sit there and actually go from beginning to actually understand what's actually going on to resolution was fantastic.
All right, Richard, your takeaway. What do you want us to know today?
Well, like he said, I just follow up with what your doctors recommend, like I said, and try to live a good, healthy lifestyle, and like I said, just be active and keep active and keep smiling, as my wife says. And my daughters all have a great family life. Our daughters all, enjoy coming out and visiting and help us every chance they get. So, like I said, life's good and I enjoy it.
Gentlemen, thank you so much for sharing your stories with us today. We always appreciate you. Dr. Hawkinson, takeaway today.
Yeah, I mean, diabetes is such a predominant disease here in the United States. It's very important to keep your blood sugars low, continue to have good feet health, do those feet checks, make sure there's no wounds, talk with your medical team. And then on the topic of social influencers, remember that can be very dangerous and there's a lot of misinformation going on. Please pick your sources for your medical advice very carefully. Certainly we've always espoused that here on this show and with Dr. Stites, looking at sites like local and state health departments, the CDC, the FDA, things of that nature. Just be careful out there because there is a lot of misinformation.
All right, All Things Heart is coming up at 10. Here's Alexis Del Cid with the preview. Good morning.
Good morning, Jess. We have a wonderful story for you this morning. It's about a woman named Tony who truly felt like she'd lost her life because of chronic pain.
The pain thing can be like a cycle where you anticipate the pain coming, so you stress up or you tighten up, and then the pain comes and it's worse.
To make it even worse than that, doctors say there's a strong connection between chronic pain and heart troubles. So that's awful. But this is why the story you're about to see about Tony is so wonderful. She found a physical therapist here at the health system who also runs a special clinic to help people with chronic pain. And Tony says that gave her her life back. So we're going to explore that link we talked about between chronic pain and the heart. And we'll also talk about the pain clinic that helped Tony. That's all coming up this morning on All Things Heart at 10 a.m. So bring your questions.
All right, Alexis, we'll see you then. Thank you to all of our guests and our viewers today. Have a great one. Coming up tomorrow, the new government rule for mammograms. Doctors need to tell women if they have dense breasts. A discussion that will empower women who live with this condition and might not even know about it.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.